Fibroids are a very common disease, and removal of the fibroids has become a very common operation. And this now can be done by minimal access surgery or laparoscopy. Hello, I am Professor Dammika Silva, Professor in Obstetrics and Gynaecology. Today we are going to speak about fibroids. Fibroids are very common tumors that occurs in the womb of the woman. Fibroids grow from the muscle of the womb. As the muscle of the womb has millions and millions of cells, each of or any of these cells can become a fibroid. A cell starts to divide, and then gradually it becomes bigger and bigger and bigger, and sometimes these fibroids become very, very large and can cause problems for the woman. Fibroids can cause many problems. If they sit inside the cavity of the womb, they can cause painful periods, they can cause heavy menstrual bleeding, and of course they can cause fertility problems. The woman cannot conceive if there is a fibroid inside the cavity. At the same time, if the fibroid is encroaching on the cavity, or if it is so large that it is near the cavity, it can also cause heavy menstrual bleeding. At the same time, it can also cause fertility problems. Also, it can cause heaviness in the pelvic area, and also it can cause pain. Sometimes it can cause pain during sexual intercourse as well. Sometimes the woman has feeling of discomfort because it can press onto the pelvis or to the sides of the tummy, and sometimes you can see that the tummy is so big because it is filled with the fibroids. What's very important is these fibroids can be treated now by doing laparoscopy. Laparoscopy means the surgery is performed by what we call keyhole surgery or minimal access surgery. A very few small cuts are made on the tummy, and a telescope is inserted where we can see the inside of the tummy on a large screen, and then the surgery is performed by very small instruments inserted through very small incisions on the side. So at the end of the surgery, few hardly visible cuts will be seen on the tummy, and this is an ideal way to perform these surgeries. Now we have this facility at King's Hospital because we provide these services through a center which we call GLEC. Stands for Gynaecological Laparoscopy and Endometrial Center, where we treat fibroids by minimal access or keyhole surgery. So the services provided are in par with any international center in the world, and we are happy to provide these services, first of its kind center in a private hospital in Sri Lanka. Thank you.